Hi, I'm Ken Mann with Equity Partners HG. With me today is Dan Dooley, the CEO of Morris Anderson. Dan manages their distressed business consulting services. And today we're going to talk a little bit about what is unique in a healthcare workout or bankruptcy case. Dan's had experience in these over the years. So Dan, I guess the first thing that jumps out to me is most of the people that you and I do business with aren't dealing with actual life and death issues day to day.
It's true.
So let's start there.
Well, healthcare is probably the only business in the world or in the country or industry in the world where people actually die, and it's not an unusual thing. If you're an industrial company and someone dies, it's a catastrophic event. But in healthcare, hospitals, clinics, people are dying all the time. So the stakes are a little higher.
And of course, everybody knows it is not quite as easy in a healthcare deal to collect your payables, or your receivables rather, and so I'm sure that presents some cash flow issues. What can you tell us about that?
Well, healthcare reimbursement is heavily driven by Medicare reimbursement. That drives to some degree Medicaid, which is a state subsidy for people, as well as all the third-party reimbursements from your healthcare providers, Blue Cross, Aetna, et cetera. And there's a number of things. Everything is a discount to Medicare payments. So if you look at receivables are always significantly less than they're stated in the balance sheet, simply because of this discount all the time. Also relative to your receivables, especially when you're talking about Medicare or Medicaid services, to the extent that you've made errors and omissions, you can actually be subject to criminal penalty for misbilling or overbilling the government entities, Medicare or Medicaid. So receivables are very, very much more complicated, much more detailed, and a dollar is not a dollar. A dollar is usually 50 cents.
Okay, that's a big difference.
Yeah, absolutely.
Pretty unique.
Yeah, absolutely. What really amazes me about that, Ken, is that they always carried on the books, or at least on their subledgers, at the gross amount, not the net amount, which creates mass confusion.
Yeah. The first day of every healthcare case, when everybody thinks they have something.
Exactly.
And then someone like you comes in, and quickly everybody realizes, wait a minute, we don't have quite
half
what
the
we
apple
thought.
is a discount. Yeah.
Okay, so I guess many healthcare businesses, certainly hospitals, rural hospitals, are filing bankruptcy left and right at the moment. They have different corporate structure than your run-of-the-mill industrial business, right?
Well, they do for a number of reasons. If you're talking specifically about rural hospitals, people will live in kind of the remoter areas of the country. They need access to healthcare, right? They get sick, they have to be hospitalized from time to time. But a number of things are going on there. One, there's a whole emphasis in healthcare about keeping people out of the hospital, because the most expensive way to deliver healthcare is in a hospital setting because of the huge infrastructure hospitals have. And secondarily, at least relative to the rural people, there's still a migration of people from the cities or from the country into the cities. So what that means is you got less beds being occupied at rural hospitals. Rural hospitals are really subsidized. They get higher reimbursement rates because they're classified as rural. And rural doesn't necessarily mean that they're out in the middle of the North 40. They can be as close as 30 or 40 miles to a large city. But rural hospitals are under deep attack right now. And the real sad part of that is that if you think about this, if you live in the country, for example, and you might be 20 or 30 miles from a local hospital, if that local hospital goes away, now perhaps you're 50 or 60 miles away. So that's a long way from healthcare if you have some urgent condition going, heart attack, for example.
Yeah. I've noticed that because of those concerns you just raised, and people wanting to make sure that critical services are provided in their hometown, that highest and best, the best part becomes very relevant in healthcare cases. Part of it's, you have a volunteer board maybe at a rural hospital. They maybe don't so much care about price in a sale as they do about other things like keeping particular services available, right?
The analogy I would give you on that is, Ken, that it's rural hospital boards are probably more like a nonprofit situation, where there's three different types of people that are on those boards. One are the local community leaders who are very concerned about just providing for the community. Secondarily, you probably have some element of professional people doctors, lawyers, business people who perhaps have some element of business acumen. And then lastly, you have what I would call social do-gooders. And it's the same dynamics that occur in a nonprofit. Their attitude is, you just need to provide the service. I don't care if we're making any money at all. That's perhaps a little bit of a naive position to take. So that those three constituencies kind of conflict in making decisions at the board level.
So Dan, similarly to the differences because of board makeup, many medical businesses are owned, at least in part, by doctors. Talk to me about doctors as business people and some of the challenges that that can present.
Well, doctors perhaps are very unique in a couple of respects. One thing, they go to school for a very long period of time and become highly educated, if you will. And they kind of, you have to have a very strong ego and a lot of confidence to become a doctor. It's almost impossible to become a good doc if you don't have a lot of strong confidence and ego. And so many doctors are the affluent people, very successful people, and they just kind of believe that they can apply that same technique to business. Not always the case. So I find doctors also come in a couple different categories. There are a small number of doctors who actually, who have business experience, understand business dynamics, understand how to manage a business. They do exist, and some of those people are as good managers as you'll see in an industrial company. Other type of doctors are ones that have no interest in business at all. It bores them to death. They said, I want to be a doctor, I want to get paid, and you just send me the money, and I don't want to be influenced with business. The middle type is perhaps the one that's a little bit dangerous, the type that thinks they're a business person because they're worth X number of dollars and they want to come in and out of a business, and they can be problematic because they think they know a lot more than they really know. I'm not so sure that there is not that sort of characteristic in other businesses too, but doctors, because of this high confidence, high ego factor, high success factor, it's a little bit more pronounced. Yeah. And they're can be somewhat difficult to deal with because of that.
One other issue that I've seen in healthcare is we've sold some compounding pharmacies, and in many medical, if not all medical related businesses, there's some level of inventory that is controlled dangerous substances. How does that play into your role in doing a workout in a medical business?
It's not uncommon. For example, we've done in a couple of private medical practices that were cancer facilities, I think 2 or 3. And cancer facilities have very substance-controlled chemotherapy drugs, and they have shelf life, and they're also quite dangerous if they're inappropriately administered. So they have to be controlled, they have to be inventoried, and to the extent that they grow old and shelf life, they have to be disposed of kind of like hazardous materials. So it's an area people can get in trouble in real quickly if they don't control right.
Dan, are there valuation issues specific to the medical industry? Is there a different way that they need to be viewed, these businesses, from a valuation perspective?
Valuation in the medical industry is a unique creature into itself in that because of Stark, and Stark is a federal law that basically restricts the ability to pay for referrals. So a doctor can't be paid a commission, an incentive fee to send business to another doctor's way. Because of Stark, valuation of healthcare businesses are primarily done by a third-party independent assessment. What does that mean? Well, that means that your ability to sell a medical practice, for example, a third party has to assess that, create a value, and the value you sell the business for has to have a strong relationship to that. Now, what does that mean? That means that, for example, if Ken and you and I agree to sell a medical practice and you're going to pay me $20 million, and a third party comes in, a professional valuation person, and says the business is worth $10 million, you can't pay me $20 million. You have to pay me in and around $10 million. Otherwise, the perception is we're paying for referrals, we're paying for the future. Now,
right. I learned today there's a whole lot about healthcare transactions that are different than other workouts, and we appreciate you sharing your wisdom and experience.
Super, thanks a
for
lot.
Being here.
Thanks very much, Ken.
Yeah, take care.